well if you need to get it.
Okay. So by way of introduction, my name is Jess Davis. I am a project manager with Region 5 for Kids, based out of Nationwide Children's Hospital in Columbus, Ohio. And on a side note, I actually, in my former life, was an ambulance director up there in the Iron Range in Minnesota. So hello, everybody. Also presenting with me is Michelle Moegling, project manager with Region 5 for Kids, as well as EMSC or excuse me, EIIC and the PPN, and kind of the jack of all trades. And Michelle also oversees a lot of the PECs within university hospitals in Cleveland, Ohio area, or Northeastern Ohio. She's based out of Rainbow Baby Children's in Cleveland, and they have 13 EDs, I believe she said. Okay. Next slide. And our boilerplate acknowledgement. All the content is coming from us, does not necessarily represent the thoughts and opinions of ASPR or Health and Human Services. And you can find our grant numbers in the acknowledgement there. Next slide. Okay. So Region 5 for Kids, we are a consortium amongst 6 states, Minnesota included, with the mission of building on the foundations that are already there to improve pediatric disaster preparedness in the hospital and pre-hospital realms. Excuse me. And incorporating and bringing together all of the networks and groups working towards disaster readiness. We do this by providing some subject matter expertise. We can provide evidence and evidence-based clinical guidelines. We have a bunch of education with webinars and courses, drills and exercises. And later on in the presentation, we'll have our website available that offers different templates, resources, toolkits, and more. So anything pediatric disaster related, we want to be your first go-to. And just real briefly, today we're going to discuss what pediatric readiness is, how to get started in a disaster as a PEC or a pediatric emergency care coordinator, how to recognize critical disaster components necessary to ensure pediatric readiness in an emergency care setting, and to identify and understand the foundational principles of pediatric disaster preparedness and response. All right, so we'll have our first Menti polling question. If you could pick one of the roles listed on the screen or on the Menti, what describes best your role? I know everybody might have a combination in there, but what's your primary overarching role within your jobs? And again, for the late joiners, we're going to have Menti questions throughout the presentation. You can see the QR code and the code to join on the screen, and that will be available on every screen in the presentation.
Okay, it looks like we have a lot of nurses and disaster management and a scattering of PECs, paramedics, and providers. So great. Great representation of all. Okay. So
I'll turn
before
it over
we
to you. Sorry,
So
go ahead.
before we start, I just want you guys to pause and imagine this scenario. It's a late night and an 18-month-old presents to your ED not feeling well all day. While waiting to be seen, you hear him having a coughing fit, and go and check on him. And as you get nearer, you realize his breathing is labored. He's really struggling to breathe between his coughs. If you are not pediatric ready, you as that caregiver worry, do you have the right equipment, protocols, and other resources you need to treat? So high stakes, relatively low frequency. Over 27 million children seek emergency care, but 80% of EDs treat fewer than 10 children per day. And of EMS agencies, they treat fewer than 8 children per month. This is a child experiencing a healthcare crisis is a parent's worst nightmare, as we know, if you are in healthcare. Every year, over 27 million families need emergency medical care. Well, that's a significant number compared to adults. It is not. Children's emergencies are relatively infrequent. That means EDs and EMS agencies don't get the expertise and experience to treat kids all the time. In fact, 80% of EDs see fewer than 10, as I mentioned, children per day. Faced with these limited resources, EDs and EMS agencies tend to focus on their adult patients they see the most. That means they may not have the pediatric skills, protocols, or equipment to care for kids. Um, this is a newer document from EMSC for Children, the National Pediatric Readiness Project. This is the route to becoming pediatric ready in the emergency department. This came out in the last probably year. You really start by preparing, looking and see what your NPRP score is, and EMS can also do their NPRP. A PEC being appointed is one of the highest things you can do and the best things you can do because that pediatric emergency care coordinator can help oversee pediatric readiness. This does not have to be a full-time job. It can be somebody who has some interest in pediatrics. It could be a team of people that have interest in pediatrics to help make sure that you have everything you need to care for kids. And then you want to assess and review where you are at and then make a plan for improvement. And there are a lot of resources you can use for that. The NPRP toolkit, it was just recently revised. I don't know if any of you have been on the NPRP toolkit before. It was a lot of articles and research, and it is now tools that you can download and utilize. Um, you can also join a quality collaborative improvement. And then get recognized. Some states have recognition programs. I'm not sure. Does Minnesota have a recognition program? If not,
No, we do not.
okay. It's still important to be pediatric ready anytime. Ohio's just started theirs recently, so many states don't have them, but it's something you may want to look into and look at. And then just keeping it up and repeating everything. So for our PEDS champions or for anybody, we actually have free PEC modules on the EIC website. And it goes over what a PEC's role should be. For the first three modules, it's really talking about the PEC. It gives you best practice and improved knowledge in pediatric medication safety. It goes over policies, protocols, and procedures. It walks you through some basic QI principles, support services, some care team competencies, and also what equipment, supplies, and medication you really should have if you are caring for any kid, even the smallest amount of kids. Um, it goes over how the PEC plays a pivotal role in the key responsibilities. How many of you have heard of the National Pediatric Readiness Project? I'm hoping you guys have. Do you know your ED's National Pediatric Readiness score? Good. Everybody, a lot of hospitals, we just had the national survey, so hopefully you guys do know what your score is and working to either keep it up or make some improvements. And that's where the toolkit comes in. Great, thank you. A lot of people. So why does pediatric disaster preparedness matter? Children have unique vulnerabilities. They have challenges telling you what's going on or how they feel. They have fear and anxiety of people that they don't know, so they're not going to want to talk to you sometimes. They have larger body surface area and can get absorb um, chemicals if there's a chemical that's out there and they get into it. They have thinner skin, so it's going to be absorbed more readily. They have higher developed immune systems, and they also have higher respiratory rates. So if there's a toxin in the air, they are going to be breathing that in more readily than an adult would. Yeah. So children in disasters, why does this really matter? Weather events, like hurricanes such as Harvey, impacted an estimated 3 million children. So these aren't just one-offs. These are things that happen across our country. Wildfires, such as in California, and we're seeing more and more wildfires all across our country. Um, they displace residents, they displace children. It has effects on children with asthma. It also affects them if it's during the school season, um, not seeing their friends. And as you know, I'm sure there's been a lot of gun violence. This affects the mental health and academic performance of kids. And we've had floods across our US in the last 5 to 10 years where there was loss of life and displacement and some mental health issues as a result of all of these disasters. So what are the effects of disasters? 25 to 30% of injuries in disasters are to children. Like I mentioned, education, you get closure of schools due to weather events or traumatic events. And mental health. A large number of children require mental health interventions due to post-traumatic stress disorders and depression following these disasters. As we mentioned, it is important to be pediatric ready every day. But does your disaster plan have pediatric considerations in it? Is it updated for the reunification and pediatric considerations? So do you include children in disaster drills, either real patients, paper patients, blow-up patients? Great. It's like quite a few of you guys do, and it's important to do that. If you don't do that, you don't, especially like if you can get some real patients, it's just a different feeling of taking a child through a disaster skill or the route to the OR and everything else, and seeing those kids come in. Our last disaster drill, um, it was mostly kids from our staff. They had fun because we put moulage on them and everything else, and they had a great time. So kids really like the scouts and can be helpful too if you have a scout team in your area to help get real patients. Only 42% of hospitals actually have a disaster plan that includes the care of children. And hospitals with low volume pediatric patients, only 37% have plans that include children. So we created this from Region 5 for Kids, and this is with EMSC as well. This is a pediatric disaster champion resource. I'm going to give you a few minutes here if you want to scan that QR code. It'll be at the end as well. And what is this resource? It was written by a PEC and subject matter expert to provide insight and framework for PECs and champions to understand pediatric disaster preparedness. It is a companion to the EMSC disaster checklist, and it's scalable and based on hospital capacity. she really wanted to do this and create this resource to share her journey learning about pediatric disaster preparedness. Because when she was told she needed to work on pediatric disaster preparedness, she had no clue where to start. And it was like drinking from a fire hose. So she wanted to help others know where to get started. Pediatrics is often unintentionally excluded from disaster plans. So that's why this resource was created, and it's a great resource. The role of the disaster champion, it could be a nurse, it could be a physician, it can be a multiple team, is really to introduce pediatric disaster concepts to leaders and staff. Really connecting your hospitals and your units to resources, and that's through ASPR's Disaster Centers of Excellence. I can't talk today. Region 5 for Kids, G7, RAPM. There's also the Pediatric Pandemic Network and local children's hospitals. If you have those in your area, they can probably help you with adding children into your disaster plans as well. And as I mentioned just a few minutes ago, this fits within an existing tool, the checklist for essential pediatric considerations for every hospital disaster policy. And this is an EMSC tool that walks you through um, foundational, intermediate, and advanced. Everybody starts at foundation to make sure you have what you need for that. And if you are a hospital that admits kids or has pediatric services, you should be more into the intermediate. And then the advanced are more the quaternary care specialty pediatric hospitals. So this is progressive and scalable. So laying the groundwork really starts with having that pediatric disaster care coordinator who oversees disaster planning in your ED. You're not going to oversee your whole hospital, but just works with the emergency managers to make sure you guys have everything you need. Um, Regional coalition building, that's more the EM team, but you can also do that because they have a lot of educational resources. And then making sure you have pediatric surge capacity. And just thinking if you had a disaster in your area, you may know who the players are. If not, you can identify them from like public health, healthcare organizations, or EMSC. They may be able to help you or know who to look and reach out to. Some key considerations when we start out is identify who leads your disaster planning, include children in disaster plan and drills. Seems you guys are doing a really good job with that. Who attends your disaster meeting as an ED disaster rep? Is that your PEC? Is it multiple people? Your PEDS disaster experts, the manager? And when we think about kids in disaster, we always think about the four S's: staff, stuff, space, and structure. You need to sure you have components built in for that. Okay. I think this is a duplicate question. Looking at operational readiness, really looking at triage and decontamination, evacuation, tracking, and reunification. So you want to first identify your disaster triage for your pediatric patients. There is SALT, there's Jumpstart, and others. What supplies do you have to decontaminate an infant or child? Because these kids aren't going to go willingly. through showers and shower themselves. If you have a family that's involved that they all need decontaminated, it's good to have the parents decontaminate the children and then they can decontaminate themselves afterwards. But thinking, how are you going to get a slippery wet baby through a decontamination? Some of the ideas and things that people use are laundry baskets with holes in the bottom so the water can go through and they're not just sitting in the contaminated water, or having a wagon with holes in them that you can put a child or infant, and same with that, having holes in it. Is there a plan to evacuate pediatric patients if you needed it? It depends if you have pediatric inpatient services, this will change and be a lot more complex than if you just are trying to evacuate your ED. And then how do you reunify children with their parents? We're going to go talk about that a little bit more. So the need for family reunification. Remember, kids, when they're in disasters, are going to shut down. They may not even be able to tell you their name or know their parents' names, because a lot of kids call their parents mommy and daddy and don't know their names. Young children can't provide reliable information about medication that they take or their medical history. A common question as we know, is what was your child wearing when there's a disaster? However, we've learned recently with school uniforms that may not be able to be used. One child was actually identified with nail polish color. So thinking outside the box of what are routine questions that we ask parents when you do a survey at the reunification center. Pediatric specific needs, legal and ethical considerations, making sure you have a plan for behavioral health, because a lot of times when there's disasters, these children will arrive at your ED, and know what children with you and youth with special health care needs are in your catchment area, because they may need to come in just to keep their meds cold, if they have medications that need to be refrigerated, if they're vent or any technology dependent, if they don't have power and don't have a generator, or if they flooded out, they're going to be arriving to your hospital as well, and being prepared for that. PEDS require special legal and ethical plans that may be in your emergency operation plans already, but just looking through that. And know what pediatric mental health screening tool that you guys utilize. And be aware, like I said, of children and youth with special health care needs in your catchment area. And make sure you have the resources and tools to care for them. And really sustaining this. Exercises, even if they're not full-scale exercises, drills and training is really important. Recovery and resilience. Why did this question pop up so many times? Skip that. Sorry about that. Really advocate for your pediatric patients to be in your drills if you don't have them now. Serve as a subject matter expert and assure you have pediatric bereavement policies and resources to give families and supplies. Work with your leadership to make improvements through training. And I'm going to turn it over to Jess.
That ever elusive mute button. So your next steps are to go ahead and review that full resource. It will be available in the slides, and I did put the link in the chat earlier as well. But it just, again, takes you through stepwise and the different steps and the scalability based upon your facility's current capacity. You'll want to identify any opportunities for your facility where you can make improvements. I mean, we don't expect everybody to do a complete overhaul overnight. Any baby step in the right direction is a great step in the right direction. Um, and then share the resources and your ideas with your leadership and your disaster team. It obviously takes their buy-in and work to accomplish this. So providing them with the resources to make it as easy as possible and to indicate your interest. Go
And
ahead and
some
sorry.
of this will take time. We've been working on our reunification policy for probably a year. Because you have to go through so many people when you do a reunification policy. It goes to legal, it has the ED, it has inpatient, it has a lot of components in it. So don't be surprised if it takes you guys more time to do that or for anything. But we're here for help to be assistance for you and give you some resources.
So, and there are some resources again, and I believe this slide deck will be going out to everybody. But our website there on top, and again, we have a bunch of the Pediatric Disaster Champion resource, which was posted in, the link was posted in the chat, but we have a bunch of others. There's ethical frameworks for risk management and including in your disaster plans. The EIC disaster domain, I believe that links to the EIC where you can find that toolkit for the MPRP and a bunch of different checklists that expands beyond just disaster as well. And the link there for the NPRP toolkit, again, that was also in the chat. And the Pediatric Pandemic Network is another huge resource, and they just have a gobsmack of
Yes.
resources in their library.
It's
It's unreal.
amazing.
So that's a great place to look as well. And then some Minnesota specific resources. I'm not sure, Dr. Guba or DePompolo, if you want to cover any of these specifically.
Yeah, thanks, Jess. Actually, Marley at Just Through MDH kind of put this list together for us, as well as put a link into our Minnesota EMSC that Chelsea Polson also helps oversee. And it's really for all of you guys to really see what we have specifically here in the state of Minnesota to kind of help you get ready, to get pediatric ready, and to be pediatric disaster ready so that you can get a little bit more information for what we provide here within our state.
Now, these are great resources. The surge preparedness checklist, identification and tracking forms. Yeah, very important.
Mhm.
Okay, and
This
then
will, oh, go ahead.
oh no, this is our contact info with Region 5 for Kids, and we have a bunch of social medias you can see there. The QR code, I believe, leads directly to the Pediatric Disaster Champion resource. And our email is available underneath there if you have a specific request or have trouble finding anything on the website, because we do have a lot of stuff on there as well. But feel free to follow us or any of the other pediatric disaster centers of excellence. And I believe
I think we're
we
going
have,
to turn
yeah,
it over to questions and open discussion. We wanted to make sure we left plenty of time for that.